for the Friday injury report. Obviously, the back has become a big deal.
Yes.
Right?
Yes.
So let us talk to Dr. Philip Koehler. Dr. Koehler, how are you, buddy?
I'm good. How you doing?
Good, man. First of all, thanks for hanging with us. We really appreciate it. You guys at Rothman.
I appreciate coming on.
Oh, my God. How excited are you for the game?
Oh, so excited. I'm getting on a flight tomorrow morning. So
You are?
Oh,
You're going? Yeah! Way to go, Dr. K. You're going down there, man. That's fantastic. This is what I love about you guys, because you guys are all brilliant minds, local, and you love sports, man. All you guys, all you guys know it. It's amazing.
Yeah.
The great, men and women physicians of Rothman. You guys are fantastic.
Well, thank you. We enjoy doing it. I think we all really enjoy our jobs, taking care of people and helping them get back to, athletics, weekend warriors. All of that is, what we specialize in. So.
Yeah, man. And listen, you guys know the game. You're fans yourself. You're athletes. You guys play. You love it. You're a part of it, man. So, which is awesome. And you're a part of the community. So you know what the birds mean to this town, right? Like, you can feel how amazing, like the passion, how close everybody becomes. It's such a beautiful thing.
Yeah, we love it. It's just everyone's amped up. The whole city's ready to go. And, all my patients this morning wearing their birds gear. It's just been an awesome year. It can't get any better than this.
So, obviously, the back we talk about the Eagles O-line and we talk about the back injury. Let's dive into that kind of thing after that injury 2 weeks ago.
Yeah, so, I guess we're talking about Cam Jurgens, but
yes.
Back injuries in general, very common injury in football.
I don't want to bring up Cam only because, just as a disclaimer, you guys do not treat the players. So, we're talking about specific injuries.
No, it's just one of those things. Back pain in general happens a lot to football players. There's been plenty of studies on this.
And centers.
And I'm not taking care of anybody specifically. It's one of those things where it's just a common injury you see across all levels of football. There's been plenty of studies that have shown it's very common among blocking positions. So your offensive line, your defensive line. And, back pain, fortunately, is usually not a extremely dangerous condition, but very painful, very debilitating condition. So that makes it really tough to perform with that kind of pain and, impact on function. All of your movement is coming from your spine, from your core. So an injury to your spine affects kind of every aspect of your ability to play. In a younger population, football players, there's not too many kinds of back pain that happen that are acute like this. Your most common injury goes to a disc problem, which are those cartilaginous structures between your vertebrae. Those structures, allow flexion and extension and bending. And when they're injured, they typically take some time to recover. There's not too many amazing treatments for it, but fortunately, high-level professional athletes do have access to that kind of care. The Journal of Spine studied disc injuries in the NFL players back in 2013. There was a study published about 275 players, and they showed that your median return to play time is about 23 days. So it typically takes about 3 to 4 weeks for a high-level athlete to come back. But your average return to play time is about 60 days in that study. So it takes some time. Treatments for it, most of it comes around, physical therapy early on. I like to say movement is medicine, so getting people moving is the best thing. Gone are the days where you're on bed rest and laid up. Manual therapy can be very helpful for this. And then medications are our typical biggest tool, using things like non-steroidal anti-inflammatories, oral steroids, and sometimes injected steroids. And if it's associated with leg pain, a lot of times, we're getting an MRI and doing things that I specifically specialize in, which is interventional procedures like epidural steroid injections.
So, the bottom line when it comes to a player like Cam, who gutted it out. We saw him gut out the second half. This week, I mean, he's been dealing with getting treatment, getting the best care. It shouldn't be an issue, right? Well, I mean, you can't, but it should be as best as possible, I should say.
Yeah, it's very difficult. I mean, the fact that, able to get back in last week is very encouraging. But I typically tell my patients, hey, you're looking at 6 to 12 weeks, and 3 to 6 weeks is typical. So that time frame is good, but it's a very difficult position. Football,
yeah,
the bending and lifting and twisting is very difficult with this kind of thing.
Doc, what do you feel? You feel good? Feel good about the game?
I feel great about the game.
Yeah, all right, yeah, buddy. I like that, man. I like that, brother. Listen, thank you so much for hanging on, coming on and giving us your wisdom. We really appreciate it, brother, man. Very much. Have a safe trip to Nolan. Root him in, buddy.
All right, sounds good. Thanks, guys.
Thanks,
Have a
Doc.
good one.
We appreciate it. That's it. Go Birds.